Today, Aaron will be demonstrating segmental diagnosis of the thoracic and lumbar spine using a long lever technique. For the purposes of this demonstration, we will begin with an area of greatest restriction screening. This screening exam will tell you where to focus your diagnostic tests. With the ipsilateral hand on the patient's head, gently introduce extension, rotation, and side bending to the ipsilateral side. Introducing motion in these planes allows the practitioner to magnify any restriction. With the contralateral thenar eminence, we'll introduce a translational force and note any restriction. The screen continues in the thoracic and lumbar regions, moving the ipsilateral hand to the shoulder and introducing extension, rotation, and side bending from this location. The screen is then repeated on the opposite side. Aaron will now begin to examine the transverse processes in the mid-thoracic region, the area of greatest restriction. A speed bump, pothole, or area of increased skin drag may indicate a somatic dysfunction. When a posterior transverse process is located, identify the vertebral level with the help of bony landmarks. Place the second and third fingers of your monitoring hand on the transverse processes. Place your axilla and other hand on the patient's shoulders. From this position, you can induce flexion, extension, rotation, and side bending to the level of the vertebra in question. Note the direction of ease and the direction of restriction. For this demonstration, ease is felt with rotation to the right and side bending to the right. Next, determine whether the segment is flexed or extended. Note the asymmetry of the vertebra in the neutral position. Now introduce flexion or extension and notice how the asymmetry changes. This vertebra becomes more symmetric in flexion and more asymmetric in extension. When naming a somatic dysfunction, we identify the direction of ease. For our patient today, T10 is flexed, rotated, and side bent to the right.